Hi everyone, this should be a pretty short video. It's on Pagets disease towards the end of chapter 50. Pagets disease is also called osteitis deformis. This particular picture on the screen is the skull of a patient who had Pagets disease. You can see it's pretty misshapen and deformed due to the way that the bones were built back up after they were brought down. So, Pagets disease is a metabolic disorder where your bone is broken down more than it should be. Your osteoclast activity, your osteoclasts are responsible for breaking down the extra bone inside your body, and then your osteoblast build back up that bone. They help to reform it. Well, in Pagets disease, because there is excess breaking down of the bones are really weak. And instead of you having a normal organized structure of bone, the bones are weak, they're disorganized, you have an increased risk for bowing of your long bones and fractures, and I've got a couple of pictures of those. There are two types of Pagets disease. You can have familial and sporadic. If you look at this particular picture, I know it's a little bit small, but you have your normal bone activity right here. You have your bone cortex and then your medullary cavity. If you look at this magnified view, you see how everything is symmetrical, it's organized, everything looks really good. Well, in this Pagets bone, you can see this area right here where it's already starting to bow over. You have a thickening of the bone, and then if you look at this magnified view, everything looks very disorganized. There are places in the bone that are missing, which helps to make the bones weak themselves. When your osteoblasts are helping to reform your bones, this particular process is very vascular. So in Pagets, it leads the bones to be weak and deformed. It can occur in one bone. It can occur in multiple sites. Pagets disease is secondary only to osteoporosis. Is one of the most common bone diseases in the United States. It affects about 1 million people. It's seen more frequently in people over the age of 50 and those of European heritage. They really don't know what causes Pagets disease. It does increase as a person ages, particularly in those 80 years and older, and men are affected twice as often as women. So some of the signs and symptoms that we see with Pagets disease, it affects 5% of the population greater than 55. It's rare under the age of 50. Slightly more common in men and more common in pet owners. That's interesting. Thought to be the result of environmental factors. Less than 30% will have symptoms. A lot of times it is strictly asymptomatic. There can be bone pain, can be deafness if the vestibular cochlear nerve in the ear bone is compressed. You can have pathological fractures. Pathological fractures are those that sometimes you don't even know you have. A patient can be walking or step on a rock, or even just picking up a book or something off the table. One of those bones can break and cause a fracture. It's usually unilateral, which means only on one side and at a specific site. And osteosarcoma, which is a cancer, is very rare. The osteoblast, which help to build up the bone, are often enlarged and abnormal. The osteoclasts are abnormal, but they're very, very overactive in breaking that bone down. It's just a chronic progressive disease. The bone scan, which will show an increased uptake in the affected bones. The urine sample can have collagen in there due to the high bone reabsorption. You can have lytic lesions, lots of really dark spots in the bone, widening of that bone cortex I showed you a few minutes ago, and then often again those bones are bent. The symptoms and treatment can be based on symptom severity, whether you've got fractures or deformities, deafness. Some of the treatment options are biphosphonates. Oral biphosphonates are the first line treatment choice. When your alkaline phosphatase levels are at least twice the normal level, things like Fosamax, Didronil, Actonil are all biphosphonates that you can be given orally. If an oral agent's not effective, there are IV medications like Iridia, Reclast, Zometa that are administered sometimes monthly or every 3 months. And then, in addition to administering medications, you can do measures to reduce pain, to help increase mobility, application of heat, gentle, very gentle massage, an exercise program. These patients may need to be referred to a physical therapist. You want to help to promote bone growth by including a diet rich in calcium and, of course, vitamin D. Provide the patient with information. There are Paget foundations and arthritis foundations and support groups. So you definitely need to make sure that we're sending the patient to those support groups. X-rays are used to diagnose Paget's disease, and they'll reveal changes, including, again, the presence of osteolytic lesions and enlarged bones with little punched out appearances. This is the picture of the bowing of a person that has Paget's disease, and this is what the X-ray view will look like. And then this is the place where the bones that are most common areas of involvement are the skull, the spine, pelvis, the femur, tibia, and then the clavicle, humerus are also affected as well. And that's the end of Paget's disease. Thank you.